Good morning. Nick Schroeder with the LAO. In March, our office produced a report analyzing the governor's proposal. And we concluded that the governor identifies a serious problem in his proposal. As Mr. Stern indicated, the $72 billion unfunded liability resulting from the retired health benefits constitutes the last major liability for the state that does not have a funding plan. And so we think it should be a high priority of the legislature to adopt a funding plan to address this liability. That being said, we think that the governor's proposal also raises a number of serious questions that warrant legislative consideration and deliberation. And therefore, in the report, we recommend that the policy committees of the legislature consider the governor's proposal as well as any other proposal to address retiree health liabilities. And through these policy committees, we recommend that the legislature seek input from professional actuaries, employee representatives, policy experts, and other members of the public. And we raise a number of questions that the staff has included in today's agenda that we think that the legislature's committees should consider. I won't go into detail on all of those questions, but I do want to highlight two of them. The first is kind of a threshold question that we think the legislature should consider before even considering the specifics of a funding plan. And that is, what should this benefit look like going forwards? Historically, this benefit has been a highly valued benefit by state employees. In the new environment, though, under the federal ACA as well as the state PEPRA, the Public Employees Pension Reform Act, the situation might be different so that future employees place a lower value on this benefit than it actually costs the state. And the reason why we think this might be possible is because under PEPRA, employees are more likely to retire at an age closer to when they're eligible to receive Medicare benefits. And if they were to retire before being eligible for Medicare benefits, they would be able to purchase health insurance through the exchange established under the ACA. And so it's possible that they would place a lower value on these benefits. And if that's the case, then we think it might be in the best interest of both the state and future employees to modify or even eliminate this benefit and offer some sort of alternative benefit instead. The second question that I'll talk about is once you cross that threshold question, just determine what this benefit should look like going forward, then you should consider what funding plan to adopt to pay for not only the benefits that have been earned to date by current employees and retirees, but also those future benefits for future employees. And the first question that you should consider when considering a specific funding plan is whether or not it pays the normal cost, which Mr. Stern already addressed. And that's putting money aside today to pay for the benefit that the employee will receive after he or she is retired. And we think that should be the primary tenet of any funding plan. So I'd be happy to talk about any of the other questions that we've raised in the report or general questions.
Okay, thank you. I'd actually like to know if there's any comments from the public at this time. Yeah, please come forward. Just to get, the range of thought out.
Madam Chair and Senators, Terry Brennan on behalf of the Service Employees International Union. Let me start with where we agree with the administration on this proposal, which is that this long-term liability needs to be addressed. Eliminating the unfunded liability over time makes perfect sense. We support that. The terms and conditions under which it should be addressed, we believe, are a subject of collective bargaining. The administration supports collective bargaining, but would like you guys in the budget to restrict that bargaining to their terms, and that's what we're mostly objecting to. The concept that we would take an 80-20 sharing ratio right now and change it to 50-50, where all the proceeds accrue to the state and not the employees. Once they hit that threshold, the lockbox and unlock it, it's reducing the state premiums and the state share, not the employee costs. Secondly, some of the other provisions, well, virtually every provision of this is the subject of collective bargaining. The high deductible health plan is something that we're very much opposed to. I have no employees who are clamoring for this option to be underinsured, to increase their premiums, to shift costs. It does nothing to lower the cost of health care. It just changes who pays for it. There's no provision in the high deductible health plan that actually lowers the delivery costs of health care. There are plenty of strategies to do that. We've been supporting them. We urge the administration to look at them. We talk about transparency, but it's not transparency on the payment side, it's transparency on the receiving side. We don't know enough information about where our dollars are going in the healthcare system to make decisions under a high deductible plan. And for that reason, we'd ask you to reject this and move on with the budget process. Thank you very much.
Thank you.
Good morning, Madam Chair and members. Dolores Duran Flores with the California School Employees Association. We also have concerns about this proposal. We have historically opposed high deductible health plans. They do not work for our members. It's not uncommon for a member of ours to earn $13,000 a year. So if you have a high deductible out there, that can easily eat up anywhere from 10 to 50% of their income, depending on the deductible, not even counting what that premium cost is. And there is the provision in this bill that requires CalPERS to offer these. We've looked at the language, our lawyers have looked at the language, we've talked to CalPERS about it, and it still does apply to school and local agencies as well. So we don't bargain with the state. We can get our health care through a variety of means, through local bargaining for trusts, and also through CalPERS. Everywhere we see them, we try to bargain away these high deductible health plans. If it is a offering at CalPERS, we can't bargain that away because they have to offer it to whoever takes it up. We don't look at these high deductible health plans as real health care. You know, you have to pay the first $13,000, $14,000, maybe even $6,000, $1,300, $6,000 before your benefits actually start kicking in. We look at it as kind of an anti-health care, that young people will actually be perhaps more inclined to purchase gambling that they're not going to get sick. But once they do get sick, they wait till open enrollment and they go back into the traditional health plans, which increase the cost for those plans. And those plans traditionally will be the people who need the health care. Seniors, people who are older, who rely on maybe more prescription drugs, have pre-existing conditions, people who have cancer, who need chemotherapy, radiation, diabetics, people who need treatment for diabetes. These are the kinds of plans that they are traditionally in. So we just think it's going to have a really poor and bad effect. And also with regard to the pre-funding, I don't think that applies to my members now, but the pre-funding issues that we had with this initially is, and something you should consider as well, is that it's not portable. So if you're requiring people to put 1%, 2%, 3% of their income in, if they walk away before they vest at 10, 20 years, 25 years, they can't take the money with them. So we think you should consider that as well. Thank you.
Good morning, Madam Chair, members. Randy Cheek with SEIU Local 1000. We represent 95,000 state employees, which most of this is being geared towards. I'd like to point out what Terry did mention earlier, that as far as the pre-funding, we do agree that there are some issues there, but this is a bargainable issue. We go into bargaining next year. By passing anything this year, you're going to tie our hands. It won't be negotiations. It'll be, this is what you get, period. And we feel that we should wait and see how we bargain this, and then it'll come to you in an MOU in which you can pass. The part of the high deductible plan, as Mr. Stern mentioned, a number of private industries had this for years and years and years, and there have been studies that show that folks who have been in high deductible plans tend not to go to visit the doctor. I know of one person that has told me of a case where she didn't go to the doctor because of the deductible, because of the high co-pays, and as a result, she wound up getting diabetes. These are the kind of things that can happen to people because they can't afford to go when they have a high deductible plan. And we feel that this is not a reasonable plan. It is a cost shift. And we also feel that not only will it harm folks like my wife who has cancer, who is a state employee, but it will also harm folks who have families, because families are not going to go to a high deductible plan they're going to have a plan that will cover their children, because children tend to get sick a lot. So we don't think that this is a good idea. We oppose the high deductible plan, and hope you will also.
Madam Chair and members, Brian Allison on behalf of the American Federation of State, County, and Municipal Employees. I just want to state we are also in agreement that there is an issue and that AFSCME generally hasn't been opposed to measures that address the rising cost of health care, including pre-funding. I think that that's the important issue, the rising cost of health care. But the governor's pre-funding proposal raises a number of concerns and questions for our members at this point, including the treatment of pre-funding contributions for non-vesting employees on the new proposal, and whether or not the proposal in this current form is going to truly result in the state and employees sharing equally in the pre-funding of benefits, or just make the longer-serving employees responsible for the majority of healthcare premium costs. I think those are policy ideas and issues that need to be fleshed out in more detail. We need to have a deliberate discussion about such an important issue. We don't think that this is something that should be rushed down, the throats of the legislature in the middle of the budget proceedings. Furthermore, this is something that should be handled at the collective bargaining table. This is a bargainable item from our perspective. And additionally, we're also encouraging the legislature to reject the governor's proposal to require CalPERS to offer high deductible health care plans with health savings accounts. Numerous studies, as my colleagues have articulated already, show that these proposals shift costs onto the backs of workers and incentivize workers to skip out on preventative care. This is going to drive up the cost of care, the cost when they do seek care. And furthermore, because the current proposal in this current state is excluded from risk adjustment, if we end up in a situation where a high proportion of healthy, low-cost enrollees on go to high deductible health care plans and other workers stay on the traditional health care plans, it's going to cause the cost of those traditional plans to rise to the point where they're no longer affordable as well. So we need to think critically about the future of the benefits that we're providing for civil service employees, and ask you to encourage that, encourage you all to have a conversation about that within the full context of the budget and the impact that it has on the state's workers. Thank you.
Thank you, Madam Chair. Members, Mitch Seaman with the California Labor Federation, also here in opposition to the proposal for a high deductible health care plan. For all the reasons previously stated, we also share a lot of the concerns and believe that the evidence is pretty clear that high deductible health plans not only threaten all sorts of unintended consequences that harm the individual health of the worker, but they also threaten many that essentially eliminate any of the savings that were originally proposed. And so we urge your opposition.
Thank you, Madam Chair and members. Mark Vittorio with AFSCME Local 2620. I don't want to take up too much time. I know most people have already said, I think, everything I was going to, but we do want to ask you to reject the high deductible health plans, and also don't tie our hands when we're going to bargain next year regarding the retiree health. Thank you.
Thank you. I wonder if any members of the committee have questions. Senator Anderson, Senator Bell.
When you presented this, does this all this is through union bargaining. So what about the CSU employees that are excluded from collective bargaining, or judicial employees? What's the plan with those folks?
Right. Thank you for that question. So the administration has jurisdiction in bargaining over the executive branch employees, as you noted. CSU employees, which is a substantial minority of our state workforce. We don't bargain with those employees, or the sort of relatively small number of judicial and legislative employees as well. So the plan includes all state employees, regardless of who your boss is. The trailer bills are geared specifically towards all state employees. In terms of bargaining, actually getting to that, the pre-funding of the contributions, that would really be left up to the employer, the folks that wear the employer hat for the legislature and the judicial branch, as well. The CSU Board of Trustees would be expected to sit down with their employees and negotiate the pre-funding agreements. There's no there's no hammer to make them do that, except through, budgetary levers that might be able to be used in the future.